Welcome to November's eCancer Medical Science. I'm Gordon McVie, the managing editor, and I've just picked out two or three news items which are of importance for this month. Two come from the FDA. One's good news and one's not so good news, and the other is an interesting paper which was delivered at the National Cancer Research Institute in Liverpool when they had their annual meeting last week. The FDA have pulled ponatinib, which is an unusual thing to happen. It's also because the drug has produced unusual side effects in phase 2 trials. About 40% of patients had problems with narrowing of blood vessels and of blood clot formation. So ponatinib has been withdrawn by the FDA and can only be used in further very carefully monitored early trials. Better news, however, from FDA is that obinutuzumab has been given a fast track or a breakthrough status because of a remarkable activity in chronic lymphocytic leukemia used in first line with chlorambucil. There was a trial of 350 odd patients showing that the combination of this new antibody versus the chlorambucil standalone 30-40 years standard therapy, obinutuzumab adds a doubling of remission time in CLL upfront in first-line therapy. Then the NCRI paper, which I thought was very interesting, which you can find on ecancer.org, is about immunotherapy of a different kind. It's a new strategy to attack neuroblastoma, particularly nasty cancer in children's oncology. We do well most of the time in children's cancers, but not in neuroblastoma. And this paper was talking about engineered NTK cells, natural killer cells, which have been engineered so as to find a specific or at least antigen-associated molecule on neuroblastoma cells. The in vitro data, the preclinical data in animals is extremely positive, and this will be going very quickly into the clinic.